Morning, guys and gals. This is Dan Buglio with painforyou.com. Today I just wanted to talk about chronic pain in general. And so it's an epidemic. Virtually everybody knows somebody who's got back pain, neck pain, shoulder pain, migraines, fibromyalgia, you name it, sciatica, knee pain, shoulder pain, elbow pain, tendonitis. And I'm here to tell you that the human species did not become frail and fragile in the past 50 years, since all this stuff has really become almost at an epidemic level. So what's going on? What is causing all this chronic pain? Well, you go to the doctor, you go to the chiropractor, they'll tell you, well, you've got this herniated disc. You've got all sorts of problems. They'll find a physical reason for it on your imaging studies. And these imaging studies are wonderful for certain things. But when it comes to chronic pain, these imaging studies actually make things worse, because now you have proof that something is broken, in quotes. But that's not really the case. As a wise Dr. Sarno said decades ago, what they find on your imaging studies are most likely normal abnormalities. The body is not perfect. Everybody is different. From genetics to posture to environment to how we treat our bodies, it kind of changes over time. So bulges and herniations, they're normal. 2/3 of people have bulges and herniations, but not all of them have pain. Many people with bulges and herniations and MRIs that look awful are pain-free. But yet if you've got one and you have pain, the doctors say this is absolutely the case. Well, what if the doctors were wrong? What if the doctors are wrong? They are, in many cases. I'm not saying it doesn't happen, but if you didn't fall out of a tree or off your roof or anything like that, and all of a sudden you started getting pain, and the doctor says, well, we did an MRI, we did an X-ray, here's your problem, and they point to your imaging study, at best, it's a guess. There's no evidence of it. Ask the doctor. Prove to me that that is exactly what's going on. So what's an alternate story that could be causing all this pain? This Dr. Sarno discovered in the 70s, as he was working with a lot of pain patients, with the standard of care in the medical industry, manipulation, injections, surgeries, you name it, and people were not getting better. And he started to ask them deeper questions, like what else is going on in your life? And come to find out, they oftentimes had other things like digestive and irritable bowel issues, or headaches, or other things that were a little bit more acceptable as stress related. And found that a lot of times the pain coincided with major life events, very stressful, very emotional major life events. He started putting the pieces together and really came up with a theory that this chronic pain is created by the brain, the subconscious brain. It's real, but created by the subconscious brain to distract us from what the subconscious brain believes are dangerous, overwhelming, unacceptable emotions. And so this sounds all very woo-woo and out there, and like that can't be the case. Why would the brain cause this? It's a defense mechanism. Basically, the brain believes, through your programming and through your own words and your own beliefs, the brain has come to believe that certain emotions are completely unacceptable. Anger, rage, sadness, grief, jealousy, shame, guilt. These things, throughout our lives, we've been taught that these things are not good. And we've learned to repress them. Why do we repress emotions in the first place? Because the brain says, oh no, these are not good. We've got to lock them away. So we never really truly allow ourselves to feel these emotions, and we lock them away. And then, once these emotions start to well up and become closer to consciousness, the brain, again, in an attempt to protect us, says those emotions are too intense. You, me, we can't handle those emotions. So what do we need? We need a distraction. And so the brain creates a physical manifestation. Sometimes it's pain, sometimes it's burning, numbness, tingling, weakness, whatever it may be. The brain creates these things in an effort to distract us from these overwhelming emotions. And then unfortunately, this distraction pain or these distraction symptoms end up becoming a whole new source of emotions. And then we become very emotional about these symptoms and the pain we're experiencing. And so between the pain and the emotions about the pain and what that means to our life, we've completely forgotten about all of the underlying current stuff in our lives that we've been repressing for weeks, months, years, decades of our lives. And so it's a perfect strategy by the brain to keep us safe from what it believes are overwhelming, dangerous, and scary emotions that are unacceptable. They don't even fit with our own self-image. And it starts a process. Now, it's very real. It's as real as blushing is. It's as real as crying is. We literally squirt liquid out of our face when we get upset. We blush. Our stomach turns over in knots when we get really nervous. We get choked up in our neck. We have a heavy heart. It feels like somebody kicked us in the gut. These are all emotional phrases, but we have very real physical reactions to emotions all day, every day. And the couple I just gave you examples of are indisputable. Nobody doubts that you're blushing because you just got embarrassed. Nobody doubts that you're crying because you're sad. These are physical reactions to emotions. So in a chronic state where it's chronically repressed and your brain truly, your subconscious truly believes that these emotions are dangerous to you, why isn't it possible that through this fight or flight response that the brain is undergoing, that there could be a real physiological change in your body that would cause these symptoms? Dr. Sarno theorized that it started in the brain with these overwhelming emotions and the brain's desire to distract us. That creates tension in the body, real physical tension. You ever get angry, your body kind of tenses up, right? That's physical. And so this chronic state of tension also affects the autonomic nervous system. That autonomic nervous system controls everything that we don't really have to think about, one of which is blood flow. So Dr. Sarno theorized that through this chronic state of tension caused by this chronic fight or flight response to our negative, overwhelming, repressed emotions, the change to the autonomic nervous system and the blood flow restricts blood flow to certain parts of our bodies. And so that restriction of blood flow, it's a very little bit, minute. He theorized 3 to 5% maybe. Nothing that damages tissue, nothing that leaves a permanent result, but just enough to create symptoms. And so we end up, because of this, we end up pursuing all sorts of medical treatments to get out of pain. And so one of the ways of knowing if you've got what Dr. Sarno called TMS, tension myositis syndrome, let's just call it distraction pain, because that's really what it is. It's simple. Call it distraction pain or distraction symptoms if you don't have pain but you've got other things going on. One of the ways of knowing is if doing something that increases your blood flow gives you relief. For example, a massage to the affected area. Does that massage help relieve your symptoms? But then once the massage is over and the blood flow returns to its normal reduced state, does the pain come back? Yes. How about chiropractic care? Those electronic stimulators. Trust me, I had them countless times. Feels good. Kind of massages, increases blood flow. Movement, walking sometimes. Some people feel fine when they're moving or after exercising or taking a hot bath. These things increase blood flow. And therefore it makes a lot of sense that those things would provide relief. But it's temporary. It's not fixing anything, because the whole process originates in the autonomic nervous system, and the autonomic nervous system is really just reacting to the fight or flight tension and fear caused by these repressed and negative emotions. So, if you're not sure if your pain is caused by this, does your pain come and go? Does it increase and decrease? If it does, it's likely not physical. It should hurt all the time. Like if you break your leg, it generally hurts all the time, right? It doesn't change with your mood or your emotional state. So if your pain comes and goes, let's say you have pain for a couple of weeks and then it gets better, and then it comes back, and then it gets better, and then it comes back again, or it stays and then it goes up, it goes down. Sometimes pain will change location. For me, I had back pain and sciatica. Sometimes it was on the left side of my lower back, sometimes on the right. Well, that wouldn't make sense. If it was physical, it should hurt in the same place all the time. So those are two examples of how you can determine whether or not your pain is caused by this distraction pain, caused by your brain trying to protect you from your emotions. And again, why would the pain, or why would the subconscious want to protect you from your emotions? Because we've been taught and we've reinforced that belief for ourselves. For example, I don't want to be angry because I'm never going to be like my father. Okay, a lot of people are like that. I'm not going to be like my mother. She was crazy. If I get angry like her, I'm crazy. Right? So there's all sorts of reasons why we don't want to feel certain things. Partially because those feelings are unpleasant. And sometimes we're like, I don't want to deal with it. I'm really sad, but I got to suck it up. Time to move on. So it's starting to rain here, and that's pretty much it. I just really wanted to explain a little bit what distraction pain is, what Dr. Sarno called TMS in the 70s. It's now also referred to as mind-body syndrome. But simply put, it's distraction pain. The more you can think about any symptoms you're experiencing as distraction pain or distraction symptoms, the faster your brain's going to start to connect the dots and say, wow, this is really not physical, is it? And connect the dots in your world. Go through and list out a pain history. What symptoms have you had throughout your life? Not just now, throughout your life. And what was going on in your life? Sometimes you'll find that, the migraines in high school were correlated to, bullying or stress or a breakup with a boyfriend or a parent getting sick or dying or a divorce in the family or grandma passing away or whatever. And go through your life and what symptoms have you had and what was going on. You will oftentimes see a direct correlation between what was going on in your life and the onset of symptoms. And if you have pain now, tell me. If you get really upset about something, doesn't your pain get worse? It surely does. So connect the dots. That's really important. And evaluate your symptoms. Do they move? Do they fluctuate? Do they go up? Do they go down? Do they sometimes disappear and then come back? If all that's the case, it can't be caused by a structural physical abnormality. So do all that. Let me know your comments. What did you discover after really looking at your pain history and evaluating your symptoms from an observer's standpoint? Don't live in your pain. Observe it. And let me know if this explanation was helpful. And I got to go because the rain's starting to come down harder. So thanks for listening, guys. We'll talk soon.